I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client Leslie is a retired physical therapist who is coming to see me for sacroiliac pain and sacroiliac joint dysfunction. And when she was supine, she had symmetry of the upper pelvis and symmetry of passive mobility, but on the lower pube, she was posterior on the left side. On the upper pube and middle pube, it appeared fairly symmetrical, and that's because movement is occurring about a transverse axis in which there's lower pube rotation. That's not in the literature, but nonetheless it happens. And that couples with a pattern that I discovered some time ago called a lower windswept pelvis, and the crease of her pants matches the crease, the gluteal crease, the midline crease. And I'm putting my thumb medial to the sit bone on the right, and it's very close. There's about just a 1-inch space there, and you can see that the space between the left ischial tuberosity and the midline crease is about 2 inches. In this pattern, you have good upper pelvic mobility, and you have relative symmetry of the upper pelvis. Sacrum has real good mobility in multiple directions, but what she lacks is movement when I try and spring this sit bone medially, and that's also true of trying to spring the right sit bone laterally, and both of these are at end range, so they also lack movement going to the left. I can take up the slack so quickly, and then there's no give with a reasonable amount of force. So there's blocked lower pelvic mobility, positioning to the left. There's also a rotational element to this. And I suspect that this pattern certainly involves the hip joints, and it involves the whole pelvis, involves the pubic joint, as we have discussed, and probably also involves movement in the sacroiliac joint. Difficult for clinicians to measure movement in the SI joint, and difficult to measure movement in the pubic joint, but we have a positional and a movement asymmetry that we've demonstrated. And also with that pubic rotation, the back or the lower part of the pube becomes ischium or sit bone, and the left sit bone is more posterior towards the ceiling. And when I spring the right side, I can take up the slack in that structure, and then I can impart movement. I see her heel bobbing. So movement is translating through that pelvis, through that lower extremity when I spring the right ischium. On the left, I'm using the same amount of force, and there's no give. I'm doubling that force, and there's no give. So there's a blockage of movement translating through the pelvis down into the lower extremity. So treatment is really simple. I will have her lay on her back shortly, and I'll place this foam under the ischium for 5 minutes to get that to derotate. Then I'm going to stretch the right hip into abduction. I'm going to stretch the left hip into adduction. I do that for 2 minutes each. Then I stretch the right hip into internal rotation, and then I stretch the left hip into external rotation. And sometimes we achieve symmetry of the lower pelvis, and we achieve symmetry of mobility. And sometimes we gain mobility, but there's still an asymmetry that is developmental. So it'll be interesting to see what she presents with. Typically, with this pattern that I named left lower windswept pelvis, typically there's a left side bent of the coccyx. In this presentation, she's fine, so we don't need to treat the coccyx. So I'll stop filming her, and I will treat her, and then we will film the response to this.